Presenting another informational video by I Buy Diabetic Supply. This video will go over everything you need to know about Breo Ellipta inhaler. 1. How does Breo Ellipta work to treat asthma and COPD? Breo Ellipta works to treat asthma and COPD by combining two different types of medications into one inhaler. The first medication, fluticasone furoate, is a corticosteroid that reduces inflammation in the airways. This helps to decrease the severity and frequency of symptoms such as coughing, wheezing, and shortness of breath. The second medication, vilanterol, is a long-acting beta agonist that helps to relax the muscles in the airways, making it easier to breathe. The combination of these two medications in Breo Ellipta helps to provide both short-term relief of symptoms and long-term control of inflammation in the airways. By reducing inflammation and relaxing the airway muscles, Breo Ellipta can help to prevent asthma and COPD attacks, improve lung function, and increase overall quality of life. 2. Can Breo Ellipta be used as a rescue inhaler for sudden symptoms? No. Breo Ellipta should not be used as a rescue inhaler for sudden symptoms. It is a long-term maintenance medication that is intended to be used once a day to prevent symptoms from occurring. It does not provide immediate relief of sudden symptoms and should not be used in place of a rescue inhaler. If you experience sudden symptoms such as shortness of breath, wheezing, or chest tightness, you should use your rescue inhaler as directed by your healthcare provider. If your symptoms do not improve or get worse, you should seek medical attention right away. 3. How often should I use Breo Ellipta? Breo Ellipta should be used once a day, at the same time each day, as directed by your healthcare provider. It is important to follow the dosage instructions carefully and not to use more or less than prescribed. 4. What should I do if I miss a dose of Breo Ellipta? If you miss a dose of Breo Ellipta, you should take it as soon as you remember, unless it is almost time for your next scheduled dose. If it is close to the time for your next dose, skip the missed dose and take your next dose at the regular time. Do not take extra doses to make up for a missed dose. 5. Are there any side effects associated with using Breo Ellipta? Yes, there are possible side effects associated with using Breo Ellipta. The most common side effects include headache, sore throat, upper respiratory tract infection, and sinusitis. Other potential side effects include increased blood pressure, increased heart rate, and fungal infections of the mouth and throat. In rare cases, Breo Ellipta can cause serious side effects, such as allergic reactions, worsening of asthma or COPD symptoms, and pneumonia. It is important to discuss any concerns about side effects with your healthcare provider. 6. Can Breo Ellipta be used with other medications for asthma, COPD, or diabetes? Breo Ellipta may interact with other medications, so it is important to inform your healthcare provider of all medications you are taking, including prescription drugs, over-the-counter medications, and supplements. In particular, Breo Ellipta may interact with other medications that affect the heart, such as beta blockers or some antidepressants. It may also interact with certain medications used to treat diabetes, such as insulin or sulfonylureas. Your healthcare provider can help determine if Breo Ellipta is safe to use with your other medications. 7. How long does it take for Breo Ellipta to start working? Breo Ellipta may take several days to several weeks to start working, as it is a long-term maintenance medication that is intended to provide ongoing control of asthma or COPD symptoms. However, some individuals may experience improvement in symptoms within the first few days of use. It is important to use Breo Ellipta as directed by your healthcare provider and to continue using it even if you feel better. It may take several weeks to achieve full benefit from the medication, and stopping use prematurely can increase the risk of worsening symptoms. 8. Can I use Breo Ellipta if I have diabetes? Breo Ellipta can be used by individuals with diabetes, but it is important to monitor blood sugar levels closely while using this medication. Some individuals with diabetes may experience an increase in blood sugar levels while using Breo Ellipta, particularly if they are using other medications that can also increase blood sugar levels. If you have diabetes and are using Breo Ellipta, it is important to discuss this with your healthcare provider and to monitor your blood sugar levels regularly. Your healthcare provider may recommend adjustments to your diabetes medication or Breo Ellipta dosing if necessary. 9. Can Breo Ellipta cause low blood sugar in people with diabetes? Breo Ellipta is not known to cause low blood sugar levels in people with diabetes. However, as with any medication, Individual responses may vary, and it is important to monitor blood sugar levels closely while using Breo Ellipta. If you have diabetes and experience symptoms of low blood sugar, such as shakiness, sweating, confusion, or dizziness, you should seek medical attention right away. It is important to have a plan in place for managing low blood sugar while using Breo Ellipta. 10. How do I properly use the Breo Ellipta inhaler device? To use the Breo Ellipta inhaler device properly, follow these steps. 1. Open the inhaler by sliding the cover down until it clicks. 2. Hold the inhaler away from your mouth and breathe out as fully as possible. 3. Place the mouthpiece in your mouth and close your lips around it. 4. Breathe in steadily and deeply through your mouth, while pressing down on the inhaler to release the medication. 5. Remove the inhaler from your mouth and hold your breath for as long as you can comfortably. 6. Breathe out slowly and steadily. 7. Close the inhaler by sliding the cover up until it clicks. It is important to use the inhaler device at the same time each day and to clean the mouthpiece regularly with a dry tissue to prevent buildup of medication residue. If you have difficulty using the inhaler device or have any questions, speak with your healthcare provider or pharmacist for guidance. Thank you. Visit IBuyDiabeticSupply.com for your extra supplies.